Mary Wood.
Thanks, Matt, and good afternoon, everyone. We're glad to be with you again today. This is, well, no, it's not the first time. Yeah, this is the first time after we finished open enrollment. So for the health benefit exchange. So congratulations to everyone on all the hard work that everyone did in helping folks get enrolled. And one of the things, just as a little plug, especially since today we're here specifically talking about Medicaid, even though open enrollment has ended for the health benefit exchange for tax credits and qualified health plans, we continue to ask for your help in getting out the word that Medicaid does not have any kind of open enrollment period, and that we encourage families or individuals who are needing health care to come in and apply at any time throughout the year. And so Healthcare Authority is looking at getting some messages out on that, and as with everything we've done on the Affordable Care Act, we look to you guys for help in getting that message out as well to the community. So today, on our healthcare Medicaid update, we're going to be sharing two topics. One of them is our newborn process, and the other is retroactive coverage. And as a reminder, these were two topics that you folks have brought up that you were interested in hearing more about in one of our first presentations. And so today we'll give you an update on both of these items. So the first one that we'd like to talk to you about today is the newborn process. And with that, at the end of this session, if you have any questions, we'll stop and we'll take those regarding anything you have questions on for newborn coverage. So in October, you might remember that the Healthcare Authority had sent out a memo letting folks know that there was a temporary process in place for adding newborns to moms who had delivered them on Medicaid but had not yet gotten their case open in the health benefit exchange. We discovered early on that if we had a mom who was open in our old eligibility system, ACEs, and we were trying to add the newborn in Health Plan Finder, we discovered early on there were some problems in doing that. So we sent you all out this memo, and we set up a process where you could contact us directly and that we would get those newborns added. Now that the Health Plan Finder web portal has been up and operational for about 6 months, most of the mothers that are delivering now have their Medicaid coverage active and open in the Health Plan Finder. And so for mothers whose coverage has been opened in Health Plan Finder, you really do not need to send that newborn information into the Ask Maggie mailbox. You would be able to go in to that pregnant woman's case in the Health Plan Finder, and you should be able to report the birth of that child by logging into the mother's account and then just selecting the Report a Change in Income or Household link from her dashboard. And when you do that, just by entering a few keystrokes, entering the baby's name and information, you should be able to receive a real-time determination that the newborn has been opened for coverage. And so, as a reminder, the easiest way for you to know whether a mom is open either in ACEs or in the new Health Plan Finder is by the mom's program code. So if you're someone working with that mom, you will notice that if she has a program code of PO2 or PO4, then she still had her coverage opened in ACEs, and you might want to continue to send those to us. If she has the new coverage group, N03 or N23, then those would be the ones that you could go right into Health Plan Finder and to try to add the baby yourself. Let me get my page turned here. So for those remaining cases where a mom may still be on PO2 or PO4, or where she still may be on coverage under family medical on, say, FO4 coverage, those are ones where she has not yet gotten herself set up in Health Plan Finder. I would recommend that you still continue to send those cases to the Ask Maggie website. And here you can see that we've given you the link once again to that website. The dedicated staff here at the Healthcare Authority will continue to open up those newborn cases for you that are reported in that on that web form. As with everything, if you should have questions about this, please feel free to contact your Healthcare Authority area rep, or if you have a case where a newborn has not been opened and you're concerned about that, please be sure to contact us as well. But from talking to my staff, it appears that most all newborns are now being opened in a timely fashion, and so if you have a case you've been waiting on, I would suggest that you contact your area rep, because we're real current on getting those newborn cases opened. So with that, I'm going to pause for just a minute, and Rebecca is helping me here today along with Matt, and so I don't know if we have any questions here that we might want to answer. We had one from someone that said, when adding the newborn and it's been, say, 30 to 60 days, will coverage automatically open on the date of birth? And the answer to that is yes. The newborn coverage always should be going back to the date of the mom's, of the newborn's birth. And so if for some reason you're not seeing that, we need to have you let us know that. Let me see, we've got another. Will the newborn need a Social Security number? And the answer to that is no. If a child is born to a mom who is on Medicaid, they do not need to apply for their Social Security number to be opened on newborn coverage. We will need a Social Security number for that baby after a year when we try to renew them for ongoing medical coverage, but it's not needed for that first year of life. Becca, do we have another question here? This one here? It says, yes, I do, but I used...
There's some questions on whether or not we can provide a list of the coverage group codes, the PO2, FO4, what they are in the Magi world.
We can do that, and so I'll have Rebecca's helping me today, I'll have her take a note. We do have a list of those, and we'd be happy to put that up, and we'll try to get that up. Jean, we'll try to get that up on our website, and we'll show you our website at the end of the presentation. We'll try to get that up by the first part of next week. But the new coverage groups in general, you will know if someone has gone through a Health Plan Finder and is approved under one of the new Magi coverage groups, because they will start with the letter N, as in Nancy. And our old coverage groups for family, children, and pregnancy medical had started with the F for family, C, or the F for children's medical, and the P for pregnancy. So that'll kind of give you, but we'll be happy to put those up for you. We have a question here that says, when the pregnant mom is undocumented and is still under the Maggie group, how do I find her on Health Plan Finder if she doesn't have a valid Social Security number? And I think the question is, if you're trying to add them to the case, and I'm looking a little bit at Rebecca here, should not mom be able to, if mom is with you, she would be able to enter her name and birth date, correct? And the case should be able to come up in Health Plan Finder?
Yes, I believe that is correct. You can either search by an SSN or a name and date of birth to find the mother.
So you don't just need an SSN to pull mom up, but you will need to have mom with you to do that. There's a question here that says, can I get a copy of what is sent to pregnant women? And I'm wondering, does that mean a copy of the award letter that is sent? Or, and so maybe we need a little bit more information on that. So we're hearing from some of you, a couple of you that are saying that you need both a Social Security number and a name and date of birth to search for an individual. We'll research that. We did not believe that was the case, but we'll go ahead and research that and see and follow up with you on that.
So this question is, how do mothers know how to enroll their infant or how to report the birth?
Well, I think what's important to note is moms, and that's, it's a really good question as well, because do folks, now that they've entered into Health Plan Finder, the question is really broader. Do they understand that they can report all kinds of changes automatically by themselves through that? And to be real honest, I think that's a really good question, and one maybe that we would ask back to our community partners, as you're working with families, do you believe that they really do know that they can go in themselves and report changes in income, report people moving in and out of their homes? And so that's a good question. Typically, let me tell you in the past that adding a newborn, our hospitals have been very helpful in this in the past, and when a woman entered the hospital and delivered her child, oftentimes over the last few years, hospitals have been very helpful in getting the newborn added to their coverage. Also, many of our moms are on managed care, and so managed care plans are also acutely aware of getting the newborn added, and so we'll help moms through that as well. So those are two ways that mom knows about it. Okay, we're just hearing back, and thanks, Chris. Chris Brown from Health Benefit Exchange has logged in and has sent something saying that for a search in Health Plan Finder that you do need name, date of birth, and SSN. So what our friends are telling us is correct. You are going to need that SSN to do that. So for a mom who is undocumented and who does not have an SSN, we'll get back to you, but that may be a case where we're going to need to continue to add those newborns here at the Healthcare Authority. So we'll follow up on that and let you guys know. Thanks for the info on that. Great. So I think what we'll go ahead is, so that we can get to the retro, we'll go ahead and move to retro coverage. While I'm talking, I'm going to have Rebecca kind of look at those, and if we've got some other questions, we'll try to come back to the newborn one. So our next topic is on retroactive coverage and the request process for that. And again, we'll kind of go through this, and then we'll stop and take some questions from you. So we've been looking at the retroactive process, and to better streamline that process, we've developed a new form for retroactive health care coverage, and it's the form number for that is a 13952. And this form can actually be used by anyone who's working with a client or the client themselves. So it can be used by hospitals or medical facilities, community-based partners, or the family themselves. When someone's application is completed by phone or through the Washington Health Plan Finder, this form can actually be submitted separately to us, and it will help us in timely processing of claims. And this form can be submitted if someone happens to turn in a paper application. This form can be attached and turned in with the paper application at that time. So for retroactive health care coverage, it is a two-step and it is a manual process. Just to reiterate, we knew when we went live with the Health Benefit Exchange that we would not be able to get in real-time determinations for retroactive coverage. And so it is certainly an enhancement that we're looking to make to the health plan finder down the road. But because of several other changes we're making and modifications that will have to be made to Health Plan Finder, I think it's safe to say that we will probably be using this kind of manual process probably through the first 2 years here of operations before we can get a real-time determination on retro coverage for families. So this is probably, as we talk about this process, you guys, this is probably one of those processes that's here to stay for a while for us. And so we'd like to hear your, because of that, we'd like to hear your feedback from you if it's not working after we get it laid out here for you, because it's something we're probably all going to need to live with for a while. So to help ensure that the request is processed timely, this form can be completed at the time of application when either the primary applicant or the head of household is present. And simply what it does by completing it at the time of application, if you can, it prevents the healthcare authority from having to send out this letter to the family. So additionally, it's also important to note that perhaps if you're a hospital working with a family member and you're looking for retro coverage for them because they're in at your hospital today, or they had a hospital visit last month that you're wanting to look at getting covered, it's important, if we would appreciate it, if you could also ask them if they have any uncovered bill for any additional months, because it may be that they had an uncovered bill maybe 2 months prior to application. And if they did, it would be really helpful if you're working with the family or the client to ask them and to fill out the form for all months where they might have a retro medical need. So retro medical health care coverage, as probably most of you know, is available for the 3 months prior to the month of application. So for example, if you were helping someone submit an application in March, we could look back at retro medical coverage for them for December, January, and February. So there's a 3-month retro look-back coverage. And the only exemption to that rule is for the new adult group. And as a reminder, we can only go back as far as the month of January for those individuals. If all they were eligible for is our new adult group, since coverage began January 1, that's the furthest back we can go. Should the healthcare authority have any questions on the information provided, additional verification may be requested if we need it to determine eligibility. As a reminder as well, requests for retroactive classic Medicaid, and those would be for individuals you're working with who are aged, blind, or disabled. We'll continue to process those requests through our sister agency, the Department of Social and Health Services, and that will be done as it has always been done. So you do not need to use this form that we're showing you today for our classic Medicaid programs. There is no longer a need to contact the HCA Meds team at Ask Maggie to initiate a retro coverage request. You can assist the individual with completing the form at either the time of application or you can or the individual or you can separately return the form to HCA for processing. So it can come in when you're applying, or if it's filled out a few days later, it can be sent in then as well. It's important to note that retroactive coverage is not automatic, that individuals must meet the eligibility requirements in those months that they're looking at coverage for. So just because an individual was approved for Medicaid in the month of April, if they were not eligible in March, then even though they had a retro coverage bill, if they were not, say, income eligible, then we would not be able to open them for coverage for that back month. This gives you an example, and I know it's a little hard to read, and we've got another little slide in a second that will show it a little better. This gives you an example of what the new retro form looks like. And as we talked about earlier, you can send this in at the time of application once the Health Plan Finder application has been submitted online and the individual is marked yes that they have unpaid medical bills. So if you're sitting with them, if you happen to be working at a hospital or a clinic, or you're a community-based partner or an in-person assister, and you know as you're filling out the application for someone in April that they had medical bills in March, you can go online and complete their application, and then you can, if you want to, assist the client in completing this form and send it in to the healthcare authority. If you're completing a paper application for someone, you can just submit it in along with the paper application. This next slide that we've got here gives you a little bit, maybe you can read it, I don't know, a little bit better look at what the form is and what we're asking for. The form just simply asks for the head of household or the primary applicant's name, their birth date, their ACEs or provider 1 number, and their health application ID, Health Plan Finder application ID number if they know it. And then it asks for the names of the individuals who are in the home that are needing retro coverage. And then it asks them to complete for the month that they're needing coverage what their gross income was for that month. So if they're needing retro coverage in the month of March, it's asking them to put that month in and what their total gross income was for that month. Right above that, it gives a little, again, a little explanation of what is countable income for Maggie and what are countable deductions as well. If you're working with families and you want a copy of this form, you can go, it's on the HCA Forms website, and we've provided you the link there to that website. And the form will be translated and available in mid-April. So by the end of next week, we're hoping to have that back and translated in our 8 supported languages. But today it's available in English for you. You can return this form either by faxing it to, and the fax number is given there, 1-866-841-2267, or you can mail it to the Meds office here at the Healthcare Authority at P.O. Box 45531. Before I get to this authorized rep slide, what I wanted to make clear to folks is that by sending in this form as you're helping families, it just speeds up, if you will, the process for retroactive coverage. If a family applies online by themselves, and they would have maybe no way of knowing this form was needed, or if you assist a family in applying online, or if you assist a family in completing a paper application and you don't attach this form, but you mark either on the online application or the paper application that they do have a need for retro coverage, what will happen is workers here at the Healthcare Authority are going to send this exact form out to families and ask them to complete it and return it with their declared income and the months in which they need retro coverage. So the reason that we're talking about this today and sharing it with you today is if you happen to be working with families and case managing them, if you happen to be a hospital, say, who is working with a family and trying to ensure that they get their coverage for the months that they're eligible for and they have a bill with you, one of the ways to help ensure that that all gets done a little quicker is to take the time, if you can, to complete the form with the family and send it in at the time of application. But I do want to assure you that if that step doesn't happen and if it doesn't come in at the time of application, that workers here at the Healthcare Authority are pulling reports where individuals have marked that they want retro coverage, and we are going to send what we call a PEND or a request for information letter out to them, and we will be sending out to them this exact form. So I just wanted to make sure that that was clear to everyone there. For authorized reps then, if the authorized rep, but not the client, signs the request form, the client needs to have answered that, yes, they have unpaid medical expenses questions on the health plan, in Health Plan Finder or on the application. So remember that this form is really a verification document, if you will, for us to get the client's attestation to their income in those months that they're wanting coverage. But be sure that if someone wants retro coverage, they do need to mark either on the paper or on the online application, they do need to mark yes to that question. Authorized reps can obtain the client's income for these months that are requested, and if the client does not sign the form and the income does not match our data sources, we more than likely will be following up with the client and either requesting verification or trying to determine their eligibility. So it's important that the client signs on the bottom of that form to attest that that is what their income is. So with that, I'm going to just go through a couple of questions. What I want to remind folks is that some of these questions that were asked about, oh gosh, 5-6 weeks ago when we did our original training or our original webinar, and there were quite a few questions on retro coverage. So I'm happy to go through these today. I'm hoping that in answering some of these questions that some of these problems have kind of gone away. As you know, we've had a specialized team working on retro coverage for families, and we've cleared up quite a bit of that backlog. We realize that there may still be cases out there that we have not been able to get to. And what I would ask really is if you have a case that's out there and you know of a family or you personally are working with a family and their retro coverage has not been approved and that case has been sitting there and you applied from January or later, anytime between October and January, and you or the family have not heard, I would encourage you to contact your healthcare authority area representative, and we'll follow up and look into that case. So with that, I'm going to go ahead and we'll answer a couple of these retro questions that were asked. It says, I've noticed that children and pregnant women have not been receiving backdated coverage for up to 3 months when they select yes. They have unpaid medical bills. What's the best way to request retro coverage? And so, as we just talked about earlier, it's really a two-step process. What you have to do is you need to be sure that you mark that they want retro coverage either on the application, the online or the paper application. Once that comes in, we're going to be pulling reports here at the Healthcare Authority, and we're going to need to send out to families that document for the 3 months retro income verification. So if you send that in with the application or while you're working with the families, we'll have it here and we'll look for it before we send the request for information letter. If it's not here, then we'll send the request for information letter to the family, and we'll wait to hear back from them on their income. So when an applicant reports they have unpaid bills and they're approved for health care coverage, HCA will send the household the retro health care coverage request form. And for each month, the Healthcare Authority reviews the information to determine if the client was eligible in that retro month. And as we talked about, the more that we can get forms to come in at the time the family is completing either the online or paper application, the quicker the process will be for families. Another question that came from someone was, for a client that is undocumented and needing retro coverage for pregnancy, but they're no longer pregnant at the time of application, how do we go about processing this application? And again, we suggest applying, stating that the applicant is pregnant, make the due date the date the pregnancy ended. If the eligibility result is not what was expected, please contact your regional representative. But if the application has a baby who needs coverage, add the child to the application at the same time. And so I'm not sure on this question if we answered what the individual was saying. I want to make it very clear. Retro coverage is available 3 months prior to the month of application, and that would be true even in the month of application. A pregnant woman was no longer pregnant for whatever reason. We could still go back, had she been pregnant in those prior 3 months, and consider her for coverage. And so please be sure that you mark that she needs retro coverage on that. If she's sitting with you and you're marking that and you have the time, I would complete the form and send it in, mail it in to us, and that will allow us then to go ahead and look at giving her coverage even though she may not still be pregnant. The next question we received, we have sent an Ask Maggie request for retro maternity 3 months ago and no response. And the patient fears collection for lab bills. What can we do? So we've answered this, to assist them in completing this form. But what I would say, again, is depending on the date of that, if it is anything prior to January or earlier, I would really like you to contact your area rep. Probably the best way is to email them to let them know that this is a problem case you've been waiting on, and we'll make sure that we get those looked at and processed as quickly as we can. How is back medical coverage getting processed? Many clients are getting sent to collections. They did not get back coverage, and will they get a letter or will it show up on their dashboard? We receive a report from the Health Benefit Exchange that gives us the list of everyone who's reported they have unpaid medical bills. And when we get that, we're going to send out that retro health care coverage form to the family. Once we receive that form, staff here at the Healthcare Authority is going to review it for eligibility on a month-by-month basis. And we will send either an approval or a denial letter to the family letting them know that they've either been approved or denied coverage. I think it's important to note that this retro coverage is not going to show on the client's dashboard in Health Plan Finder, and that's because, as we mentioned at the start of this section, this is a process that right now we don't have automated in Health Plan Finder. It's something we want to add in the future, but we don't have it now. So you're not going to see letters coming out of Health Plan Finder on this, and you're not going to see the approval in Health Plan Finder. If you are a provider or someone who or a clinic, someone who has access to Provider 1, you will see the retro coverage in Provider 1 once they've been approved. So you will see it in Provider 1, but you won't see it in the Health Benefit Exchange. The next question, can I use the Ask Maggie email to request retro coverage for Washington Apple Health kids and adults? Certainly nothing prevents you from using that, but I would strongly encourage you, instead of using that, I would strongly encourage you to complete the form and send it in when you're helping the family. It's going to be the quickest way. When it comes into the healthcare authority, it's going to be imaged directly in. The form's been barcoded, so it'll go directly to the staff that are working on the retro medical process, and it's just a much cleaner and neater way to ensure that people don't fall through the cracks, if you will. So certainly nothing prevents you from using Ask Maggie. I would strongly encourage you that the best way to do it now is to send that form in, because staff are working those on a daily basis. The next question was, how long will it take to process retro coverage? Well, I'm not going to, and I really want to be clear and state to folks, we appreciate everyone's patience in this. Certainly, we were not processing in October retro coverage as timely as any of us would like to see. So we are hoping now, as we get this up and going, that retro coverage will be processed within 45 days of someone applying for benefits. We're even looking at being able to automate some enhancements where we can auto-send this letter to families. So if we get a request for retro medical and that when we look and the family hasn't sent in the form yet, we want to be able to auto-send the form. So we're looking at ways to make it more streamlined, but we want to be sure, we really want to be sure to say to you folks is, if you have cases where you have not heard or the family has not heard, it's been January, December, November, October, they applied anywhere in there and you have not heard yet on it, if they've not received an approval or denial, we really do want to hear from you on those, because those should be getting processed by now, so we want to make sure that those cases are taken care of. Okay. And Rebecca, I'm going to stop because she's got quite a few questions coming here. And can you talk to them a little bit about this mass mailing, Rebecca?
Yes. We're receiving a lot of questions on households that requested retro, and it's been several months and they haven't heard anything. We are working on a mass mailing to address this massive amount of households that haven't heard from us. We have a target date of mailing a letter to them along with the retro form. Our target date is hopefully within about 2 weeks. If you have a household like that, it's all requests through the end of March is what we're looking at. So it's from October through March. We're hoping to do one mass mailing to all of these households with your retro form. So you may, if you have a couple clients asking about it, you may suggest that they wait another 3 weeks or so for them to receive a letter from us.
And Rebecca, wouldn't you say if they feel because they may very well have collections, let's be honest on this. So if we have someone facing that, or if we have our community partners, or if we have hospitals, providers on the line today, if they know of a family who said, no, I haven't heard anything or back, they could simply, if they wanted to, complete that form and send it in for the family at this time. I mean, that's possible as well. There's nothing that would prevent them from doing that. Is that right?
That's correct. And I'm hearing of some issues with bills going to collections. And so if you have a case like that that needs retro to be processed urgently, please assist them in completing that form, and then let the regional representative know that the form has been sent in to us so we can look for that and process it.
Right, right. So, I mean, I think right now that's our best approach. We have, I know Rebecca said we're doing a mass mailing all the way back to October. wanted to reassure folks that we've been working on this process, and we've done many cases, you know, several thousands of cases from October, November, and December. But we have, you know, there's been sporadic. Some cases were open late and retro back. So we do have some that we're going to go back even into the month of October and catch a few cases that were opened. But I didn't want people to think we hadn't been working. We've processed a lot of them. I think one of the things we're finding is that of the letters, because Rebecca has a team that's been working on this, of the letters that have been going out, Rebecca, we've probably only been getting responses back on, would you say, less than 20%, 15%?
Yes, I don't. A lot of the households are requesting retro, and so we send the form to them, but we don't hear back. So we don't have a real high response rate to that.
Yeah, and you guys, we don't know, I have to be honest with you, we don't know if that low response rate is because folks are not understanding what we need them to do with the form, or if folks just, a lot of people maybe didn't understand what retro coverage was and so just marked yes. Do you know what I mean? Like maybe they had a bill earlier that month and weren't sure that it was going to go back and pick up that bill, so they marked yes. So like I say, we've received a lot of requests, but our response rate from clients has been, I think it's around 15% or so that are following through on. So just as an FYI, let me go back and we'll ask, get back to this question here. How will we know know that the retro coverage has been reviewed and made effective for the person? And as we talked about, there'll be an award letter sent to the family, either or a letter sent to the family, either approving or denying coverage. So the family will receive a letter, and if you are a provider, you will their coverage will be updated, and you will see that in Provider 1. Their coverage will be there. A next question is, I've heard that the button for requesting retro coverage for medical doesn't work, and that the health plan finder is not actually working properly. And I need to stress again that is not the case. We knew when we went live in October that retro coverage would not be included at go live, and an automatic determination of retro coverage would not be included. So this is not a problem with Health Plan Finder. When you click yes that there's retro coverage needed, what it does generate for us is a report, and that report is worked by staff here at the Healthcare Authority, and they send the letter out to the family asking for them to attest to those 3 months of retro coverage, so, or their income in those 3 months of retro coverage. So as I said, I think down the road this is certainly an enhancement that we'd like to see to Health Plan Finder, but I want to make it clear that we certainly knew at Go Live that that function would not be available. So with that, I'm going to ask Rebecca if we've got maybe time for a couple of questions. Rebecca, is there a particular theme or questions, or, because I see we've got quite a few there. We have a question that says, you know, and it's true that not all income and deductions could be included in this short form. Would it be possible to have an instruction sheet detailed in? We can certainly look at that and adding an instruction sheet to that. So we'll take that down as kind of an action item. We can certainly do that. One says, I have an on-site HCA worker. Can she process retro coverage? And, you know, I think I'll go back. I'll take that back to our folks who oversee that staff. I believe that they might be able to do that. So let me take that back and ask them, because it is a meds function that we do, and perhaps that would help in some of the facilities. And so, in fact, we have a meeting right after this with the meds leadership, so we will ask them about that. Can you see anything else? The one question says, will AREPs receive a copy of the approval or denial letter? And we should do that. And so yes, I'm going to say that they will. They'll get a copy of that if they've listed themselves as an authorized rep. So okay. So you guys, I want to take just a minute. I'm going to go through these last couple of slides, but before I start, just to show the resource contact, I wanted to just kind of give you a heads up of what's happening in the future here for us. We have another webinar scheduled for, I don't have a calendar, scheduled for, is it in my sheet here? Thanks, Matt. Matt's always helping me. Scheduled for the 24th. And on that one, we're going to talk about classic Medicaid, and we're also going to talk about the application process for classic Medicaid and kind of the handoffs between Magi and classic. So that webinar will all kind of revolve around that, and we're going to have partners from DSHS present with us on that so that we can kind of hear your concerns, and we again are trying to do some things to make that process a little more streamlined and easier for families to navigate. But beyond the 24th, we do not have any additional webinars scheduled. And my question to you guys, and if you have a few minutes and can type in while I'm talking here, if there are additional topics that you would like us to kind of review or go over, we have no problem in meeting with you this way and doing additional webinars, but we do need to hear from you whether there are additional topics that you would like to discuss. And so if you have some topics and you want to type those in now, Rebecca will kind of note those. If you need to think about it a little bit, I'll show you. Matt, can you click forward to our here to our additional Medicaid resources? Right here on the additional Medicaid resource, we do have HCA Medicaid contact us, the Medicaid expansion at the bottom here, 2014 at hca.org. What was that, Matt? Did I do something wrong? It's okay. So if you want to think about it, and maybe within the next 2 or 3 days, if there are some particular topics you would like to discuss, if you could send us something at that contact us box, or those of you who know me, if you want to drop me an email, that's fine too. If there's enough interest in topics, we'd be happy to carry this on through May or June, however long. Are they still hearing us, do you think? Can someone just let me know if you're still hearing me, because we're getting some feedback here. Okay, they are. Thank you, guys. So if you can let us know on that, we are more than willing to continue these if they're helpful for you, and if there's things that you want us to discuss, we're happy to do that. So Matt, will you click back just 1 second? I wanted to make sure on the HCA area reps, if you can just show those 2 slides for just a few minutes. We mentioned that several times today, especially in light of if you have a newborn who you've been waiting and they don't have coverage. We feel that we've gotten that really all the way caught up. So if that's the case, I need you to email your regional rep and let them know that. And again, if you have anyone who has retro coverage and they applied from January back to October and you have not heard anything on that, I need you to let your area rep know. And if you have a family who maybe has applied earlier than that and is, for whatever reason, on retro coverage, they're really getting a lot of pressure from anything going to collection or that, we most definitely want to hear about that, and we'll try to prioritize that and get those done quicker. So please be sure that you contact your area reps on either one of those issues, and we'll go from there. Matt, if you can just go to that last slide on the, again, those are our, we've shown that before. I think the most important one today is the contact us. Go back just one sec, Matt, is the contact us. Just if you have topics that you'd like us to put on a May webinar with. And also, we also in our training and education, we will be adding the information to that, and I think we'll add to this the health benefit, the retro form. I think it'd be nice to have that there so people can download it there, but it's also at our website. And Matt, on the next slide for me. Thanks, Matt. So then, just so you know, guys, the next scheduled one will be the 24th, and this, as we talked about, will be topics on classic Medicaid and the application process for classic Medicaid and how that interfaces with Maggie Medicaid and applications for that. We acknowledge that that's been a little bumpy start, and we feel like it's smoothing out, and we've created this the 18005 to be a classic Medicaid form. So we're hoping that things will continue to get smoother there, but we do want to hear from you as we talk about that on the 24th then. So thanks everyone for attending today, and appreciate it. And again, I really want to thank everybody for all of their help since the 1st of October in making this thing happen. So I really appreciate everyone's help and effort. Thanks a lot. We'll talk to you